Brian, for
So,
all the interruptions.
no problem. Let's kick off. Welcome, everybody. Thank you so much for coming to this vision workshop. It's very, very nice to see everybody here. And thanks to our speakers, Pip, Aga, and Anne. Where the idea of this is that we in End Social Care Disgrace have a whole range of policies, and we make some very general statements. For instance, we want a national care support and independent living service which should be publicly funded, publicly provided, and publicly accountable, and we want to remove profit from a transformed social care system. And when we say we want to remove profit, what we decided was that we needed to understand much more clearly what that meant. What I was trying to say was that this meeting is really about trying to help End Social Care Disgrace develop our policy together with other people, and to in particular understand what it is that we mean by non-profit. So we're not expecting at the end of this to have a new policy or to define the policy exactly, but this discussion will help us get there, will help us understand the detail, what's available now, what do we mean by non-profit, what are the options. So we're very pleased to have the speakers to expand on all of this for us. Before I move us on, yes, housekeeping. So if please stay mute unless you're actually speaking. We'd prefer not to put anything in the chat during the presentations, because we found that some disabled people find that really complicated and difficult to manage. So please avoid the chat during the presentations. And I'd just like to say a particular thank you to Anne Gray, who has really pulled this all together. Anne has written a fantastic book, which I think she's outlined in the paper that she wrote to us all. And really, she has thought these issues through in a great deal of detail, and we're really grateful to her for having fronted all this up and set it up. So what we're going to do now is to hear first from Anne an overview of not-for-profit provision. Then we're going to hear from Aga from the Equal Care Co-op, and then we're going to hear from Pip Cannons of Community Catalysts, and then we will be up for debate after that. So welcome to Anne. If you give us the overview and kick us off, that would be really helpful. Thank you.
Thank you very much. So what do we mean by non-profit? This term is used rather loosely, and I must confess I use it loosely myself. But what it really means is not for profit, rather than being profit-driven. Every business needs to make a surplus over running costs, whether for reinvestment to guard against the risk of a sudden drop in income or to guard against a rise in costs. But the issue, I think, is the motive, the driver. Is it profit or is it something else? Some people would say that not for profit means not profit distributing. But let's look at that carefully. Salary and bonus maximization might still be an objective for senior managers. For example, about 14% of residential care establishments, 14%, are run by big charities, and so are about a third of housing associations. They have some version of charitable status legally, but they may have very highly paid senior staff. Charities can't pay directors or trustees, but they can pay their staff. And CICs can pay directors as well. So moving on to co-ops, are they truly non-profit driven? Some do have shareholders who are not workers in the co-op, but usually this is just a result of raising money by public subscription at rather low interest. For example, Community Roots based in Manchester, which heads up the cooperative housing movement, and lends to housing co-ops and a few other co-ops as well, and pays shareholders about 3%, which is very modest. The worker members in co-ops may well be interested in getting better pay than they would from councils or care agencies, and also maybe much better training and career progression. But quality care is also very much an objective, as you'll hear from Aga. In another example, where care workers left Rochdale Council in 2014 to found the co-op, which is now called Possibilities, they said they were looking towards better quality services and more user control, as well as higher pay. Anyway, I think what any co-op's workers get is just payment for their work. It's not money for lending money. The profit margins of care co-ops do vary, as you can see from a few examples in the background paper. Some are very low, some are encouragingly high, which does permit reinvestment and growth. Now, cutting out shareholders saves some money, which can go to improving the quality of care or paying workers better, which probably contributes to quality of service anyway. This issue about pay is a big one in the case of residential care, where the operating arm of a home, a care home, is often squeezed by a financial company that owns the premises or has a mortgage on them. National chains that operate many homes often split the company group into a real estate arm and an operating arm. Each is a separate company. And then the real estate arm squeezes money from the operating arm, and the operating arm then can't survive on the money that it gets. The Scottish TUC wrote an important critique of this process, and an additional finding just yesterday about for-profit versus non-profit care homes was reported by the Centre for Health and Public Interest. The profit-driven ones reduced staff during the pandemic, while the non-profit homes increased staff during the pandemic. So then let's turn to microenterprise. Microenterprise is based on self-employed individuals and small groups of workers who come together as partnerships or small companies. What's the story about profits and motives there? Let's think about the possible motives for someone becoming a self-employed care worker. Maybe they worked for a care agency and want more money or more security, or just to deliver better quality of care for their clients. But a key factor is that if they are experienced care workers, they've chosen to stay in an industry where pay is low because of the constraints on funding. So they're unlikely to be in it mainly for the money. Other people who do microenterprise may have been volunteering and decided to make it part-time paid work. Their background as volunteers says something about their motivation. And I think both these categories are more likely than agency workers to deliver quality care and attain to the human relationships involved. Self-direction means they can be more responsive to clients' preferences and needs, whereas agency care tends to be run, unfortunately, in a rather tick-box way in many instances. Self-employed individuals as well generally work directly with their clients and family carers, if there are any, using personal budgets. There is no intermediary. That does help to create a direct, humanized relationship. But it also means that people may need help with managing personal budgets, whether the client does this or their family does it for them. The Northwest Co-op, based in Chester, brings clients together in user cooperatives and helps them manage that crucial paperwork. That's a very important function which councils could help much more with to make it easier for both microenterprise and co-ops to operate and to put their clients on personal budgets. However, looking at the opportunities for cost saving via non-profits is limited by the pressures of low government funding for this work, which is why a lot of agencies and homes are saying they're not financially viable, handing back contracts and basically giving up. There is some scope for making care cheaper, but part of that is very much via improving its quality. And there it's worth thinking about outcomes-based commissioning, which I think is important in this context. That means defining the care plan in terms of what the client wants to achieve, rather than just a list of tasks that says, wash this person, dress this person, take them out for a walk, etc. This is obviously much easier output-based commissioning with highly motivated people who are committed to co-production and a real human relationship with the client. And if it can be done, it often results in less care hours being needed because the time is used more effectively and in line with what the client really wants from day to day. It may also help to develop the person's strengths and reduce their long-term dependence on care workers as well. And I've seen an example of that in my personal acquaintances. So lastly, what about care enterprises set up by local authorities? This sort of thing, local authority trading companies, is much more common now than direct in-house provision, because only 7% of the adult care workforce are now actually employed by local councils. There are at least 20 LATCs, local authority trading companies, in social care. I haven't been able to trace all of them, but a common pattern seems to have been to set them up to save costs when in-house provision was much more widespread. According to the report from Unison, which you have a summary of in the background paper, that often squeezed workers' pay. In principle, it could have been otherwise, and this was the hope of some of the early proposals for social enterprise in care, using municipal enterprise powers. But unfortunately, the way it's worked out is, fairly right-wing councils in some instances, no overall control in others, trying to save costs by getting the care workers paid a bit less than they would otherwise have been. Councils are anyway slow to act, and their policy planning teams may have been emasculated by cuts. So I think rather than councils trying to contribute to this picture by founding social enterprises, much better that the independent initiative should be seen as a way forward. And councils can best contribute perhaps by stimulating non-profits and contracting with them. And when we come to contracting, one way in which they can do this is to help small care enterprises and self-employed individuals to come together for joint bids in competitive tendering. Manchester is or was trying to do that, and maybe we can find out more about that in the run-up to our October conference. Thank you very much.
You're muted, Brian.
You're mute,
Brian,
Brian.
can't hear you.
Thank you very much, Anne. That was extremely detailed and very quick. And I'm wondering if there are just initial questions about content or details, or whether people wanted to clarify anything that you've said. Are there any queries from anybody about?
I can send around the notes. I mean, I was literally reading a lecture because I
Sure.
wanted to save time. So sorry if it was a bit fast, but thank you.
I mean, one of the things that I think you didn't talk about, and what I think one of the options that we have kind of assumed is a non-profit in the future would be a properly funded local authority with perhaps some voluntary sector contributions, and that the local authority, as in the olden days, would provide residential care or home care, and there would be no profit in it. It would just be a service that was publicly funded and publicly accountable. We know that very few of those exist, but are there reasons why that couldn't happen with adequate funding and political will?
I think the main reason is, as I said, the emasculation of councils' policy planning teams at the centre. And this is why I think less things tend to be run and founded in-house than used to be the case. That's the only answer I can think of anyway. I mean, there must be some reason why in-house provision has declined so much. Thank you.
Great. Any other questions of Anne? Okay. Oh, Marianne.
I've got a question. I wonder, is there any kind of cost analysis? Because my thought is, as I understand it, in the past, councils used to run care for themselves, and now almost all care, it's run through some sort of private company or other organization. And I wonder, I'm sure there's been some sort of cost analysis of how much this has driven up the price of care?
I think that's hard to estimate because there are so many factors involved. I mean, one is that the care industry is very labor intensive, so that how much workers get paid, which is very much a political decision in some sense, is really a very important driver. I mean, councils, if and when they employ in-house workers, consider things like the Equality Act, the various council pay scales. And one contention of the Labour Research Department report for Unison was that contracting out tends to have been a way by which people avoided, councils avoided those sort of conditions and made things cheaper. But I think contracting out to care agencies is a very different cup of tea from contracting out to not-for-profit enterprises of the kinds that we've been looking at. So that's a factor to be borne in mind.
Great. Mike, only for clarification, just if you've got a more general question, then we'll take it at the end.
Having now said that, I don't know.
Let's take it at the end. Take it at the end, Mike, and we'll hear.
I won't be here at the end, actually.
Okay. Go on then.
Okay, so I will have to do it now, which is, as we know, the whole care home sector has been hoovered up more and more by large corporates. You know, either just large care home-based companies or private equity companies who are sort of sucking the life out of things and see care as something that they can get their fangs into. What is the imperative, the driver that is driving smaller, far more people-friendly, and sometimes almost not-for-profit organizations into the arms of these people? And I realize you might not be able to answer it fully until after I've left, but I'll leave it as a question anyway.
I think that's a very general question, and I hope Pip can throw some light on that as well. But I think, first of all, yes, it is the sheer greed of the private equity companies that have decided to hive off the real estate arm and kind of, as you so clearly put it, milk the homes dry. But there's an issue about economies of scale and the fact that councils like to make block contracts with very large organizations, which is particularly an issue for non-profits competing in home care. So I think perhaps that's a very general question, which we should leave till after the other speakers have contributed.
Great. Thank you very, very much. So, Aga, could you introduce yourself? We don't know anything about you, and we're really eager to hear about the Equal Care Co-op. It's been talked about a great deal, and it's really nice to actually meet someone from that organization. So welcome.
Yes, hello. My name is Agnieszka, in full Rolkievicz. I'm from Poland, if anyone wonders where my accent comes from. So I have to say I'm not typically a speaker, I'm rather a community organizer, and my role in Equal Care Coop was to help shape this, practically apply certain principles of how really commoning and commons can support, which in other words, I have to straight away say is really a network. It can be seen as community networks that have same goal. Really, in our case, it was Care Commons. And as such, I don't know if you want to probably hear more about Equal Care Coop, which is actually based in Yorkshire. And we only, in 2021, we decided to kind of test the ground in London and have chosen neighborhood of a very deprived neighborhood in Hackney called Clapton, where with another community organization who similarly had similar aims, because that's what kind of first ingredient of even like collaborating locally around improving. In our case, it was care that we provided for or wanted to provide for elderly. So we collaborated with sheltered housing in that area and started from running activities really, because after pandemic, it was also a time where people really needed to reconnect, as my background is applied theater and the other co-founder of the circle, Luke Tanner, he worked in change of bringing change to social care. So we really, my knowledge about like salaries, to be honest, and all like kind of economic more of, it's not very deep as such. That's why I take time to say that through working with or different type of organizations. So there were mentioned like cooperative as such. It has certain principles of many of them, but it's basically consumer run workers cooperative, and our cooperative is multi stakeholder one, but we seen as changing only kind of salary of a care worker, it cannot really possibly improve the care. So the first question, for example, input, it was how we made sure this care is improved. So obviously by giving better payment, because it's 15 to 20 pounds care workers employed through Care Coop could earn. And they had also this flexibility of like they could be employed on payee or self-employed, and their hours would be really always suiting their lifestyle or choices. Additionally, through Care Coop, you can actually match the person who is receiving care, can choose the right person for them. And through platform, internet, like platform where certain information are held and exchanged, we could also cut a lot on the administrative and otherwise like very bureaucratic kind of part of running any business really, not only cooperative. So but going back to that question of quality of care, I want to emphasize that we really focus on creating local networks, strengthening these networks through really strategic collaboration around food, around craft engagement, gardening, and we provided community meals outdoors and indoors on regular basis, providing also takeaway food, because we found out that as care workers would be able to improve that type of indoors care, which is like personal care, medication, changing some, decluttering the house, whatever it takes, cooking possibly, because normal care workers are not really able or allowed. This is kind of mystery, but they don't cook. So this was the main change we really wanted to bring, but also bringing more of a teamwork where the person receiving care would not only rely on the care worker, but on sometimes family, sometimes friends, sometimes strangers who would become the regular like befrienders. Or have similar interest, and just kind of on the type of budding system, they would create a team, and that team within the circles and within the Care Commons could only thrive, because otherwise working singularly, as everyone knows, care workers have very disconnected way of working. They never almost can talk with family members or with others around issues they come across, which here the platform is very useful, because every day after every visit, you know, a care worker is putting different types of messages that are related to the next, to planning for the next days, or reporting on what happened really. So it's like creating security and trying to improve collectively really the care. I'm not sure, maybe it's better that I take some questions, because I know I didn't kind of probably cover what I even thought I would be talking about, but it's just hard, it's very complex to talk about cooperatives and then care worker, and then really my bit is the commons, the more of a and more innovative way of looking at the local networks that could, I believe, provide also some economic value and surely social value, which is so much sought after, and that is something what potentially could bring also interest from those who have money or otherwise are interested to in maybe larger context of like you were talking about authorities that should be in the in the strategy. Can I propose that I will rather take question if people have, because I don't know if I'm really even talking in the right area.
Yeah, well, I think what you've described is really pretty inspiring. So thank you very much for that. But by all means, let's. But if we can stick to again to questions of clarity, you know, to clarify if there are any things that that you'd like to make clear what Aga said, would be very helpful. Esme.
Hi, Aga. Lovely to meet you. I'm in the London Borough of Southwark, and my understanding is that we were like an observer partner in the Clapton project. We have been told that the project wasn't successful. So can you clarify, A, whether that is the case or not, and B, if that is the case, why do you think that was so? Sorry for the blunt question.
Yes, so as far as I know, because I did ask, but I did not read any official report why it happened. But as far as I know, it's due to like it wasn't financially feasible, valuable, and basically. So, because we propose higher wages for the care workers, we had like kind of agreement with council to also pay more towards. So it's not 17, but it's 19. Or I'm telling you, I wasn't in the recruitment part, and I was focusing mainly on the community part of development, community development, but it's mainly down to the fact as well, in my mind, that during 1 year, 12 months, you know, everything was achieved, because we're supposed to do playbook evaluation, set up 5 teams, which all happened, and as such, all the process was successful. But for example, transferring people, because in order to employ care workers through Equal Care Coop, the person receiving care had to be on direct payments. In some cases, it took 9 months to go through that process. So often it were certain impossible for us to fasten up the process. And additionally, even recruitment process actually took quite a long time, because so maybe that's the scaling kind of question here, which I wasn't always agreeing with, and that 5 teams, I thought it's not gonna take off the ground, because in my mind, most of people are looking really for full-time jobs, which means minimum 20 hours per week, which that means already in the recruitment part, we wouldn't be able to offer multiple people the same amount of hours. So we kind of had to decide that maybe we lose that person, but we keep that person with the full-time. Or so if we would have more clients, which we kind of could, but there is always this problem of balancing and timing. So we decided not to expand and keep these 5 teams, but in the same time, most of the recruitment basically proved to be difficult, because of like many people really not eventually taking job, really, because also our pitch wasn't maybe that strong, because we said Luke was honest to say that it's like a pilot, and obviously we will want to. So we still have people employed through Equal Care Coop, and really I've done some interviews, and it's been wonderful change, but to change as such, even to find people who would like to transfer and take care and choose and be member of Equal Care Coop, that is also very time consuming and requires trust, which we were able to establish before, but like 12 months, it's really like a type of thing you can say set to fail. So that's my answer.
Thank you. You're on mute again, Brian.
Sorry, 2 more questions, please, and then thank you very much for that answer. I gave 2 more questions. So Jenny, and then Mike, and then we'll ask Pip to speak. Thank you.
Oh, thank you very much. Thank you, Aga. That's very, very interesting. I've read a bit about the Equal Care Coop, and I'm very interested in it indeed. Are you still running in Hebden Bridge and Clapton? And if so, how many clients do you have, and how many staff do you have?
Okay, so I will start from Clapton, because I don't have necessary information about Hebden Bridge. They do run. They had 80 teams previously. I'm not sure the state at the moment, because the manager, the care manager there, Kate and Emma, founder, they have left last year. So I know there has been changes, but also with plans to maybe go to different cities. And with us personally, once the pilot closed, like the salary of Luke closed, and I'm still there, but on behalf of Clapton Commons, and I'm a community animator, and now at the moment we do peer advocacy. So we're trying to establish in the same sheltered housing with the same people a similar, function we play, but not under Equal Care Coop. Although people receiving care through the carers that's been employed by us, by our circle. So it's like unfortunately, certain stage where I'm personally like almost by myself in that position, like maybe not necessarily waiting for a miracle, but also not able to officially represent. Or I was proposing to run monthly meetings for the teams, and if not voluntary, then otherwise I meet these people all the time. I visited our first client, Hazel, moved to nursing home last week, but that's the thing. We were planning to do community share offer or something like that before the news about, like going bust came. So.
And how many people in Hebden Bridge, Aga?
Working care workers, I don't know. I know about 80 teams, so means clients, people receiving care, and that would mean around 80 care workers. But teams as such, I can provide this information, and they have very extended information, like holistic explanations on the website. So I would really suggest that playbook. If you write playbook, is more about our Care Commons. I will send the link. But the Hebden Bridge website, not sure as well how updated is that, but I can maybe find out for you and follow up with this information after today.
Thank you.
Thank you, Mike, and then we'll move on.
Yeah, thank you, Aga. Really interesting. Can you just say where training and career progression fit in with your scheme, please?
Yes, so I would be, yes. So that's kind of when we were starting, that's where I was at. And really, Luke is a trainer, so he worked in culture change in from more institutional kind of approach to peer-led. Where I am educator as such, and I always thought like quality of care really come from quality of training as well, and some type of even maybe formation, because my background is like I work for L'Arche, so I'm not sure if anyone knows, but it's like a community of many people with learning disabilities living in the same houses. So it's like a small kind of more of a how you would call it, clustered kind of way of living, many houses. But there is very much emphasis on not calling people that they are core members, and everything is like very much coming from the culture of learning from each other, and similarly, I suppose cooperative care should have much emphasis, which we were trying to give this type of introductory provide sessions where we're comparing like different types of care. So we're giving 3 types, comparing to supermarket where you just go and buy anything, to the community garden where people can actually plant and have what they want, and trying to see the differences that we can make as well. What would make the difference in where we can make that difference. So there was some initial training and plans to really emphasize on that, but yeah.
Thank you.
If you're
Thank you very
interested,
much.
I could also possibly share.
Yeah, I mean, if maybe if you could put your email in the chat when after Pip has finished, and we'll have a more general discussion, then people could ask you their questions by email, and you could respond. That would be great. Fantastic. Thank you so much for introducing us to the co-op and its principles. Pip, thank you very much for joining us. Tell us a bit about you. And
yeah, will do. If it's all right, I'm just going to share some slides just to help make sure. Thank you, I think. Yeah. Okay, from beginning. Brilliant. Okay. Hi, everybody. Thank you so much for inviting me to talk to you all today. I'm Pip Cannons. I'm the CEO of Community Catalysts. I've got a few slides to sort of flip through just to try and structure a conversation. I was asked to answer these questions, so that's what I'm going to try and do in about 10 minutes and then hopefully give you some time to ask me any questions because like with Aga, I'm sure that I will miss some bits that you're very interested in. So I'm going to start by just explaining who we are. So Community Catalysts is a community interest company. We were established in 2009, really to fill kind of this gap that you've all been talking about. We could see that there was a need to change what social care was all about, and we felt that was a real opportunity to do this. So off the back of the personalisation agenda, if you like, there was a real drive towards direct payments, offering people the opportunity to take money instead of services and use that money to purchase their own care and support. But what we knew is that there was nothing different for people to purchase. So we were set up with that intent to help develop that different resource. So that's our core function, really. So our vision is all about that. It's about creating the stuff that people really want to help them live their life their way. So anyone that has, cause to draw on care and support for whatever reason, for a health condition, for as a result of aging, as a result of a disability or a learning disability or autism, all of those reasons, people who need a little bit of support to get on with their lives, we want to make sure they're able to access the right type of support. So the things that help people to live a gloriously ordinary life, as opposed to a lot of social care, which basically covers the basics. It gives you, the ability to survive, but not always to thrive. The challenge as we see it is, multiple, but as a kind of two parts that I'm going to just talk through. So the one challenge is that people are very different and want very different things. So one of the reasons one of the things that we're talking about in this conversation today is how do you create something that suits these guys, the commissioners, but also suits the population and that individual, that personalised approach. And I think it's really key that we remember that. And I talk as an ex-commissioner here. I do have to put my hand up and admit I worked in local authorities for about 10 years trying to change the system from within. And the system is really geared up to factory processing. It wants large, scalable solutions because they're easier to manage, particularly in the face of increasing demand. So more people, whereas in the in the private sector or in most companies, increasing demand will be a good thing. The public sector panics about that and just wants an industrial-sized solution to manage that demand as efficiently as possible. And that is part of the key problem. So that's where we come in. That's what we understand. So a lot of the role that we play is really to bridge that understanding. We come from a community perspective. We understand communities and how they operate, and we see things differently in people and communities. We see the strengths. We see the things that people could offer if they were allowed. But we also understand the public sector, how it operates, its constraints and its barriers. And really managing that sort of void between the two enables us, I think, to help to bridge that gap. So what we do, essentially, one of the core things we do is we help local people. So people, like you, like me, who want to do something in their community to use their skills, their talents, their experience to support other people, to provide care and support to other people by setting up their own enterprise, their own business, or running an activity. And the enterprises that they run are for other people within the same community. So these are things that we call micro enterprises, and they are very locally run. Usually people will work within a couple of miles, so within your own neighbourhood. So you're supporting other local people. So really, what does count as a micro enterprise? I think it is just worth just talking about that, because we've talked right from the beginning about profit, not for profit, co-ops, different sort of mechanisms. And I just want to emphasize that for us, the key ingredient here is it's about local people supporting other local people and being driven by really strong values that want to help within their community, to do something, to use their skills and what have you. So it's a values driven, a strengths driven model, if you like, at its very core. But that's the essential ingredient, that alongside that local that local bit. They are therefore independent of large organisations, and we do support community enterprises that are bigger, but a lot of the work we do is with these micro enterprises. So that's generally 8 or less, and they do operate on that continuum. So some of them are for profit, some of them are not for profit, some of them are entirely voluntary. We help people to set up the business or the organisation or the activity that's right for them, we don't start with the model, we start with what's the right thing for you. So what do they do was one of the key questions. So microenterprises, when they work in people's homes, do all sorts of stuff. I'm not going to go through it, but all the usual things that you would expect, that's about enabling people to get up and do things and get on with their lives. Looking at this list, you might go, okay, so what? How is that different to core care? And by core care, I mean that provided by your care agency. Well, the key difference is this: it's local and it's flexible, and that is the core difference, I think. But microenterprises isn't just about providing care in the home. A lot of the projects that we run are also about thinking differently about day support, or day opportunities, as we like to call it. So the traditional way of supporting people during the day is a day centre, and what we do is provide alternatives to that. So we will support people to think differently about what a day opportunities look like. You don't need to read through it all. I will share slides afterwards. It's just to give you a flavour of what we mean by the types of care and support that people do. So really, it's absolutely anything. We've got people doing jiu-jitsu, we've got people that offer gardening, we've got people that offer cooking, we've got people that help people get up and about, we've got all sorts. But the key thing here is it's local people using their own skills and talents and experience to support other local people in ways that matter to them. So very tailored to the individual needs of both the worker and also the individual needs of the person or the family seeking support. Scalability was one of the questions. So is this a model that can scale? And my answer to that is absolutely. But I heard the note of caution in Arga's voice, and it's in mine too. So while I absolutely believe in micro enterprises, I do think it should not be scale for scale's sake. Where we find the best projects or where the magic happens at the pace of the communities that we're working in. Sometimes that's rapid, but mostly that's very slow and very deliberate, and it grows with the needs of the local population. So sometimes we'll work in a valley like in North Wales, where we were asked to help in a very rural location where there was no care and support for an aging population, and we were asked, what can you do? So we went in and we had conversations with the local people and asked, does anybody want to offer care and support to other local people? And of course the answer was yes. So we helped people to set up, do the things that they didn't know how to do, which was setting up a business, running that sustainably, understanding how to find customers, how to keep customers, how to get the money from the council, etc. So supporting people to set up sustainable businesses is what we're all about. So from a scalability point of view, you can see from the map that we've worked all over the UK. We have worked in rural locations, we've worked in urban locations, we've worked in coastal, deprived, really rich areas, the whole lot. So the model works in all of these different places. How scalable it is within those places very much depends on the need in those local areas and what it is that we're trying to achieve. I come from Somerset, that's where I live, that's where I am right now, and that's where I was a commissioner, and I commissioned Community Catalysts to run a development programme for microenterprises here a long time ago. And after 7 years of running that programme, we now have about 2,000 micro enterprises operating in Somerset, and it's an absolutely established and core part of the offer in Somerset. But that I can talk about that later. But I just want to say it can form a part of the core offer as it is in Somerset, but in other areas it's for very specific reasons. They want to look at a specific cohort of people, or there's a particularly difficult area where it's difficult to find care and support, and we might go in to find different ways of doing it. Or we might just have a role which is to diversify, to provide choice and control, which is, of course, the tenet of the Care Act, and very critical and crucial as well. So what is the value? What's the benefit of micro enterprises? Why do we do it? What's the benefit? And I suppose for me, the starting point is it makes a difference to people's lives. It's entirely personal. It's very tailored. It's, it's local people providing local support. So it's people that you build a trust and a relationship with. And I think you hear that in everything that Aga was talking about the cooperatives as well, that real spirit of creating something that's very built on personal relationships and that trust within a local community. So it's also about co-producing stuff. So it's not about this is what I do, this is, and I only do this and I only turn up at these times and it may not be me next time, but that's tough. It's not a robotic response. It's actually a very personalized response. So what is it that you need? How might I be able to help? And then we also network our workers as well, so that they are able to then perhaps say, well, I can't do that, but I know someone who might, and they might then enable that person to find care and support from other people who operate in a similar way. So it's this sort of working that enables choice, that enables people to take back control over their care and support in their home and in their community. The cost thing, I don't like talking about that. It is cheaper, but I don't like that. I think this is something that we should be talking about as good value. I think it's often perceived, and one of the issues with saying, oh, well, it's cheaper, isn't, or whatever, is that then it perhaps it is devalued. I think it's good value. We do lots and lots of analysis of, when the Home Care Agency publishes its minimum cost of care calculations, we calculate what that means for micros and do recommend. We can't dictate, they set their own prices, but we recommend what they should be offering their services for within a certain range. And we also really insist that they pay themselves well, and that they pay themselves sickness, they pay for travel, they pay for training. All of these things all need to be factored into their price. And so we support them to think about all of those things, so that they are offering a service that is sustainable at the end of the day. There's also environmental benefits, and there's flexible working. A lot of the people that work for us work for 20 hours or less, fitting it in around all sorts of other jobs, e.g. There might be caring for parents, they might have children or whatever. So it is a very flexible form of employment as well. The business case, I think I sent that round as a link beforehand, but basically just to say that we have had multiple research done into our programmes. So we know that the evidence base is strong. We know from people telling us that they really value the kind of support that micro enterprises provide, and that they prefer it when offered the choice. They prefer it to that provided by agencies. But we also know there's an economic and a social value benefit as well. So lots of evidence there. And last year, Wales did a big piece of work on it. And again, it came out very favourably, showing that micro enterprises can be used in core care as well. They operate really well when integrated into the local offer, and offered for everything. And that's the experience I had in Somerset, is that it is an ecosystem solution. It's not something on its own. It can be used very flexibly. I have got a video. I'm not sure I've got time to show that now, but this is a lady that just talks about why she decided to set up her own micro enterprise. She used to work in a care agency, and why she feels it is much better working for herself and running her own organisation, and the benefits that she feels she gets from that. And this is really just to emphasise that ecosystem piece. The micro enterprises are the small bits of sand in this jar that, you know, for me, how I work with commissioners, how I describe this is it's not an either or. And this is also a conversation I have, by the way, with the care agencies who weirdly get very anxious about micro enterprises for some weird reason. This whole David and Goliath thing, they're very worried about David. They get very worried that we're nicking their care staff and that we're nicking their demand. I can tell you, we're not. We don't do either. We retain people in the care industry that would otherwise have left, and we've got loads of research into that. And we also make sure that there is flexible support for all. So for me, it's about, you still need blocks of bigger organisations, but I would hope that they would be well run, that they'd be run on values, where possible, not for profit. Although my argument there is that I've seen some terrible organisations and terrible care from some not-for-profits, and equally some really good care for some for-profits. So for me, it's the values and how people work and their aims and objectives is most critical. So the quality of care people provide is much more critical than the business model that they run. But we work alongside a lot of care agencies in areas that we work, and where that happens, it works for all. The barriers, just very quickly, there's loads of barriers to having a different model of care. You mentioned some of them, Aga, and I think in the discussion earlier on, after Anne was talking, there's many. It takes a really long time to change ways of working. That culture change takes time. So practitioners need to understand that there is different types of care and support available. They need to understand it. They need to trust it, and they need to know how to get hold of it. Who are they? What do they look like? How do I tell the people that I'm trying to support what they look like? DP, so direct payments or personal budgets, or personal health budgets, are a critical mechanism for enabling the money to flow. But they're often held on to by a local authority or by the NHS. They really control that money. They need to let go. They need to also make sure that the direct payment is at a suitable level. Often a direct payment is significantly below the hourly rate that they would give for an agency, and I completely disagree with that. So part of the work that we do with local authorities is to get them to think differently about direct payments, because that mechanism is critical for sustaining a different type of marketplace. I could go on. There's absolutely loads of different things, but the other thing that
if you could wrap up in a
yeah, I will.
Pip,
One more
please,
minute,
yeah.
I think, is time. You know, a lot of these programs really take time to get going. You know, you need to build that momentum, and that really is very critical, and that's what we do. So we help to do all of that. That's a core part of the role that we have, is to help on both sides of that equation. So both the community to grow, but also the local authority to be open to different kinds of care and support. And that's it. Thank you very much. Any questions?
Thank you very much, Pip. That's great. Really insightful and helpful. Now I open it up to the meeting to what do people think? Are these options that we in End Social Care should consider? Is it something that would really improve outcomes and care? Is it something that we instinctively feel is not right for us? What are people's reactions? Anna.
For me, there are two things going on in my head. One is massive regret there was nothing like this for my son, because what each of you has been describing is putting the person center stage. Now, that was talked about decades ago, and it was attempted to be enacted for a short period, and then in the big organizations, that kind of just disappeared out of the window. So just kind of at the most superficial level, it's very, there are models here for actually enacting what started years ago, but for people who've been in these big organizations, it just didn't exist. So I think it's hopeful, and I'm afraid I'm always going to be regretful that, none of this could benefit my son's life, let alone his dying. So I'm really, really interested in all these projects because I think they're a beginning for thinking about what we should be trying to put together, taking the essence of all of them and saying this is what we need, if we're going to improve social care. So sorry, that's a bit woolly, and it has stirred up a lot of stuff for me, as you can imagine. But it is very hopeful, I think. Thank you.
Thank you so much, Anna. That's a heartfelt response and really important one. I've got Joe and then Gordon.
Yeah, this has been a fascinating hour, listening to so many different ways of delivering care. And yeah, I can see, Anna as well, that it would have been nice to have had something around like this when I needed it. However, there are a few things that kind of cause me concern, and I don't know whether that's because of my socialist background. I think the idea of communities helping each other are great. But I do also think that there needs to be a basic framework within which staff work. And that's not to say that the way that they operate within different people's homes has got to be a tick box exercise where they're doing exactly the same thing everywhere, but that they have the same regulations and standards that they are expected to adhere to when they're delivering care, that they have the same terms and conditions of employment in terms of the pay that they're given, the pensions that they are paying into. I know that from my point of view, as somebody who was delivering a massive amount of care to my daughter, I don't want direct payments, thank you. I want to have that flexibility of delivery, but I want it delivered by the provider. And in the case of of what we're envisaging as within EScaD, that would be through the National Care Support and Independent Living Service, which would provide that flexibility of delivery whilst maintaining a control over the regulations and the way that staff are trained and employed. Yeah, okay, I'll shut up now. I think I'm wandering now. So,
Gordon.
Thank you. Thanks very much to Anne and the other two contributors, Anne of whom, of course, I know well, but three excellent contributions. I really have to say that. So many, many thanks to you. What it brings to my mind is one simple but always all-consuming issue is how do big authorities, local authorities mainly, learn to work in real partnership? So that's the question that's opened out by this, I think, is how can real partnership working, not just a tick box recognition of co-production, which unfortunately is what some of them do, some of them are a bit better than others, but how does real partnership working, understanding across the board, perhaps going back and forwards, much more secondment from for weeks or several months at a time from a local authority into something like, for instance, community catalysts or the local enterprise. How could real, actual relationship developing and partnership working between the bigger authorities and the micro enterprises or community groups be much more central to what the big authorities do and training and development and career development and everything that goes with it. So it's just a plea for thinking much more in depth about partnership working. The examples we've seen are very good. The local authorities will tend to still be defensive about all of this stuff, as has been mentioned. So how do we break that down, really? That's the open question.
So can I take Linda's question and then ask the presenters to respond to these really important challenges? Linda.
First of all, I'd like to thank EScaD. I know there's been a lot of planning behind this. I think it's an excellent, absolutely excellent foundation research thing. And also the speakers. I'm singing. I feel as if I've had a bottle of whiskey. I'm just absolutely so excited about the three speakers and the content. I would like to very much connect with Pip because we set up. I set up a charity in my home in 1995 because I was so angry about the lack of values in the organisations that we were involved in, and also the lack of values, and also everything was staff orientated. And as I think it was Joe who said, as they talked about person-centered, it went on for decades. It's even now disintegrated into what everyone has to do because, well, why? Because it's convenient to the staff. I love the idea of the micro-enterprise that Pip talked about. We had planning consent to build 7 flats on our location, and because I was very unwell, caused by the social care industry and bullying, the planning expired. So I've now got the task, and it's my last opportunity to create something like that Pip talked about. And I get furious about the word control and power. I have said, and it will be in my memoir book, that people take away power. They strip people of their personal power when they have no right to do that. And it's happening all the time. I see it in front of me. And people have no right to do that. People in high-paid jobs or whatever. And that needs to stop. We need to be dealing with that. The only other thing I want to say is that, and these are not really questions unless somebody can come back to me with advice. The organisation my daughter's living in with supported living, it has, I think they call it core and cluster, but the core is the head office, 3 big, large floors. I mean, it's an enormous building above a supermarket.
Linda, I need you to wrap
Yeah.
up. I'm sorry.
So they're being paid thousands and thousands, the staff, and the workers are being paid a little bit above the basic salary. And I'm so angry about that. But it's what it is at the moment, and we need to have a revolution to change it upside down. I hope it'll happen in my lifetime.
Thank you, Linda. So I know we've got Anna, Larry, and Tony raising questions, but can I ask the speakers to respond to some of these challenges and queries? Who'd like to go first? Pip?
Yeah, thank you. It's great to hear back from you. Person-centered is what drives us. You know, we believe firmly that the people that draw on care and support should be at the centre of the decision making, and that the care and support only exists because it's needed for them. So, you know, that's the bit that we talk about is the shift in power, the shift in control has to come away from the centre and has to come to the person. So, you know, and that's the bit that we really champion. And for us, the mechanism that supports that is direct payments. And I appreciate that there is a difference of opinion on that, but that's an enabler that enables the power to come away from, because money is used as a power tool to direct support. So, giving that power to the people enables choice and should enable control, but only if there are choices available. And that's where, you need to do both. You need to have a practice that enables that and supports that, but you also need to have that market capacity building and that to change the options that are available. On regulation and pay, absolutely. Part of the purpose of the businesses that we set up is we want people to pay themselves a decent wage. We want people to use their skills. We want people to to use their experience, use their skills, and pay themselves a decent wage. Otherwise, it's not sustainable. This is why businesses go up, because people just can't afford. If you can't afford to feed yourself and have a roof over your head, how are you going to provide good care to somebody else? So that's an absolute, that's part of our programme. Now, regulation, there is no regulation for very small if you're providing certain types of care and support. We work really closely with CQC, so the Care Quality Commission, to make sure that we understand the regulation. And this is kind of where, one of my colleagues would say, this is where we're anoraks. We understand regulation and we also understand the HMRC rules, etc., etc. And this is where it's about optimising all of those so that it benefits everybody. And for me, regulation does not prevent harm. You have all watched Panorama. So this is about how do we ensure quality? And I firmly believe, and I've always said this, I've always quoted it, if you are providing care and support in your neighbourhood, you are less likely to cause harm than if you're there's so many people can see, people know what you're doing. I don't know about around your way, but there's people know what's going on. So a lot of it is around the safeguards that we help people set up, the policies that we help them set up, the networks, etc., etc. That circle of support that Aga talked about as well. All of those are ways of providing day in, day out quality assurance, as opposed to regulation, which is an annual check on a list of questions, etc. So there's different ways of regulating, different ways of quality assuring. I'm not saying that I disagree, and it is about providing a professional service, but without killing it by over professionalizing or over regulating. In my opinion, as an ex-commissioner, I would have thought that commissioning, regulated would have been better, but I can assure you it isn't always the case.
Thank you. I don't know if any of the other speakers want to respond, but I'm keen that somebody responds to Gordon's question about, obviously what we're talking about here is about wonderful, personalized, improved quality of care. So how can we support local authorities to do that as well?
Could I say something about that?
Please.
Yes. I think one of the big attractions of micro-enterprise to me is that it solves some of the problems that Equal Care came up with in Clapton. It's existed in several dozen local authorities in quite a scale now. And that scale, having several dozen micro-enterprises around doing different things, helps to both create a pool of clients who are being matched to individual services and workers, and create a pool of people who are providing them, so that there are then opportunities for various different business models to be created. There might be partnerships, there might be cooperatives, there might be consortia of self-employed people who come together to solve this issue of scale and change of culture, which local authorities apparently need. So, I can see the sheer versatility and the experience behind the micro-enterprise movement as being a very big stepping stone to provide the bulk of quality, flexible care that we need to see happen. Thank you.
Thank you. I'm concerned about time, so I'd like to take. I'll go. Do you want to respond? Briefly.
I would just say a joint enterprise, which is public common partnership, which is like a collaboration between, you can check that out, but that's what we're trying to kind of really bring the council to take that responsibility as well to provide.
What's that technical term? Joint what? Joint?
PCP, public common partnership that is like a type of joint enterprise, which previously apparently in England it was more exactly for like private enterprise, but this is an idea where both cooperatives, community services can actually, you know, provide, but where authorities are having, let's say, they part in it. Like 50, here is 50-50, where we don't think it should be 50-50, but it's one of the ways to deal with bigger kind of scale solutions.
Thank you.
I'm not sure.
Okay, Anna, you've already asked a question, so could I prioritize Larry, Tony, and then you, if that's okay? Larry?
Thanks so much to everybody. I haven't been so moved and encouraged in many decades, I have to say,
Wow.
by the tone as well as the content. I try to think from my experiences in voluntary sector and in councils, the one place I've seen that has a model that might bridge the gap between the councils and all the other kinds of groupings. You know, that was the community work model, where people worked to the council, got paid by the council, worked in relatively small areas. They helped create groups. They worked with groups. They were able to make it easier for the council to put money across because they were considered relatively reliable. So I wonder if that might be one of the elements in getting this into the connection between the council and everybody else.
Thank you, Larry. Community work and community development has been something I've been passionate about for a long time, so it's very nice to hear you say that. Tony?
I had a longer run into this question, so I don't want to sound off in my tone. But what I was asking, what I want to ask really is, if you take a question of safeguarding of people in their vulnerability in their homes and in their day-to-day lives, how does Community Catalyst overview what was staggering for me, that there are 2,000 different enterprises in Somerset, so the scale of that is huge, and as somebody has said, I think it was you, Pip, that there's good and bad in every model. There's good and bad doctors, therapists, and this, that, and the other. But who supervises, for example, safeguarding people who are receiving the micro-enterprise care? Is it Community Catalyst, or is it the local authority, or does Community Catalyst answer to the local authority, or is it not? It can't be nothing. So who guards this process, if you like? And I'm just using that as an example, which is, you know, uppermost in my own professional background, but for children rather than adults.
Shall I answer that quickly?
Yes, please.
Not a quick answer. Of course, safeguarding is absolutely critical and important. I think one thing that I first of all need to say before we get into sort of the business of safeguarding is that micro-enterprise support is not for everybody. You need to be able to self-direct your support. So it isn't for everybody. I think that's the first thing to say. In terms of safeguarding, so we work in partnership, and this also slightly answers the question before. So we work in partnership with local authorities. We don't work in isolation at all. So we're commissioned by a local authority to develop this resource and to ensure that it links into the local authority, that there is that connection. And it's that connection that's really important for a number of things, and including the safeguarding process. So the link for us is that either we employ what we call a catalyst, who is that community worker, that development person, that link worker on the ground, if you like, that develops the capacity but also works with the staff in the local authority. Or increasingly, local authorities employ that person and we train them and support them in that role. But the end game is always that this legacy stays in the local authority, and the person, our catalyst, if we've employed them, would always transfer into the local authority. That's exactly what happened in Somerset. I brought after running the programme with Community Catalyst for 7 years, when I felt it was running well, sustainable, etc., I brought the catalyst in and employed them as part of my team, and then made that team much bigger. So what are the safeguarding things that we put in place? Well, first of all, it's about the doing it right standards, the framework, the principles that we set up right at the start. So being very clear with people what good care and support looks like, what the policies are, what they need to have in place. So we set them up properly to provide good care in the first place. There is then the catalyst, who is there as a point of contact, and if there's any issues with the care that's provided, then the catalyst will be the first port of call for someone to go in to see, is this a training issue? What's the cause here? If it is found that it's a safeguarding, and I have to say, in the years that we've been operating since 2009, we've not had any safeguarding upheld for the thousands of micro enterprises that we have issued. There have been a number of concerns raised, but we have managed that through this process. We always work in partnership with the local authority. We work with the safeguarding teams, because ultimately safeguarding sits as a responsibility of the and it's a specialism of the local authority, and that's why that partnership is so critical. We are not a floater out here. We are absolutely connected and linked into. It's a partnership program, and so we're all in it together. So on one hand, it sounds like 2,000 in one county of micro enterprises is scary, but you haven't asked that question of your care agencies. Your care agencies are massive and have thousands of workers that are going in and out of homes. They're not all monitored on a regular basis. So it's a very similar. Well, we're a much smaller scale to that. And I would say that because of the way that we set up the programs, that relational basis means that, and because it's so local, and because we network the micros, if a micro finds out that one of the other micros in their group is not doing good quality care, they will tell on them. They will say, I'm worried about the care and support that they're providing. And that's where we then step in and provide support, training, or whatever it is that's needed to help them to get up to the right standard. And if they don't follow that advice, then we will remove them from the programme, and we will report them, or if that's required, to CQC or to wherever it is required. So we've got huge amounts of background in that.
Thank you.
That's very helpful. I do think we said we'd finish at past, so I think we need to finish at past, Anna. I'm sorry that we can't take the question. It seems to me that this has been a very inspiring event, and thank you very much to everybody for participating, asking the questions, giving the presentations. To me, it feels like all of these ideas are struggling against a profit-driven world, and that's what has crippled the co-op in Clapton. It makes it very, very difficult for many of these alternative ideas to work. But it's clear that it is possible, it is inspiring, and it really does make a difference. If care is offered that is personalized, that is relevant, and that really supports people's independence. So we have a model. We know it's possible. We know it can be done. What we now have to think about is, to what extent does EScaD want to support these ideas, and how can we really promote, well, whatever it is we decide, we have to work out how we might then make it happen and promote the ideas. So I thank everybody again for their contributions. I always now still say safe journey home, but very inappropriate for these online meetings. Thank you very much, everybody. And we look forward to continuing the conversation. I haven't looked in the chat, by the way. Have Pip and Aga, and I guess Anne, but we do have strong connections with Anne. Put your emails in the chat so that people can contact you if you don't mind. I mean, if you don't want that, then obviously don't put it in the chat. But otherwise, it would be very helpful. So, thank you very much. All the very best, and we've really learned a great deal from here. Thank you.